So, diagnosis of glaucoma, we are going to discuss about the diagnosis, that how we can diagnose glaucoma, which instruments are used to diagnose glaucoma. So before diagnosis, let us look at the normal flow of aqueous humor, that how aqueous humor flows in the eye. So normal, we can see this is the cornea, this one is structure is the cornea, and this is lens, cornea and lens, and this one is the iris. Now this is anterior chamber, and behind the iris there is posterior chamber, anterior chamber between posterior surface of cornea and anterior surface of iris. Anterior chamber is there, and posterior chamber starts from posterior surface of iris to anterior surface of lens. Now uh, normally what happens, that aqueous humor is produced by ciliary body from here, ciliary body, and it goes into posterior chamber, and from posterior chamber it drains through iris into anterior chamber. It travels through iris into anterior chamber, and from anterior chamber it goes into uh, trabecular meshwork, and then through canal of Schellem, episcleral vein, ophthalmic vein, and then into cavernous sinus. It is drained. There is normal pathway of drainage of aqueous humor from ciliary body to the posterior chamber, and through iris it comes into anterior chamber. From anterior chamber it comes into canal of Schellem, and it is drained into cavernous sinus finally. So this is the normal flow of aqueous humor. When any pathway this of aqueous humor is obstructed, there is any obstruction in the aqueous humor flow, causes elevated intraocular pressure, no drainage of int, no drainage of aqueous humor, causes glaucoma. Now coming to the uh, instruments used to diagnose glaucoma are the tonometer. This one is the tonometer. So all use of tonometer is known as the tonometry. We detect intraocular pressure with this instrument. This is tonometer. This is the structure of tonometer. It has numbered scale, as it is indicated here. This one is a numbered scale. Indicator needle is present, which shows the reading of this scale, and hammer. This one is a hammer, frame, handle, and the metal plug is placed here. Curved metallic foot place. This one structure is kept on the cornea to detect the intraocular pressure. If change intraocular pressure means greater than 21 in glaucoma, 21 millimeter of mercury, that will be changed in the scale. So the use of tonometer is known as tonometry. It measures intraocular pressure, and there is the Short's indentation tonometry, is a method in which measure of pressure is indicated by cornea by plunger having fixed weight. This is the Short's tonometer. Another is the gonioscope. Use of gonioscope is known as a gonioscopy, and gonioscope is the instrument which is used to evaluate anterior chamber or anterior chamber angle for assessing width of anterior chamber, uh, in order to diagnose the type of glaucoma, that which type of glaucoma is this. So what happens, that when gonioscope is placed here, as we can see, this is a gonioscope placed on the cornea to visualize the angle of anterior chamber. There is the we can look at this one angle, that whether it is obstructed or not. This gonioscope, there is a reflection, means image in iridocorneal angle. We can visualize this angle of the canal of Schellem at this place with the help of gonioscope. Another is the fundoscope, means we visualize the fundus of the eye with the help of fundoscope. Examination of the fundus by using ophthalmoscope, slit lamp. This is a fundoscopy with contact lens for evaluate the optic nerve head changes, that whether how much cupping has been occurred, how much damage in optic nerve fibers has happened, and the optic disc cupping disc to cup ratio can be visualized with the fundoscopy. And we can see that in the glaucoma patient, fundus